Hi. Good morning, everyone.
Good morning. Good morning.
I do appreciate Carol allowing me to do this, because this is something that I'm very passionate about. It's something that I've been working on my credentials for, and so my presentation today will get me my final credential as a certified diversity trainer. So I've been a practitioner, been doing the research, and so even though I'm being paid as faculty for the institute that has trained me all of these years, I need that last little piece, and I'm very excited about that. I had an opportunity, Fonta had asked me recently to come and speak to her group, and so that opened the door for us to continue the dialogue. And one of the things that I always maintain is that diversity training is not a one and done. It's not something you do at the beginning of the year to check off a box. It is something that we should be living and breathing every single day, because there are opportunities more than we can even count to educate other people. Now, we are counselors, we are caregivers. That does not mean that we are innocent of any of the things that we know can be done and said to other people. So we have to look at this through the lens of ourselves and the people that we work with, as well as the people that we see every day who come to us for help. So words and actions that can create barriers and build walls. Whenever someone has microaggressed against you, it's really difficult to move beyond that and have that relationship with that person that you thought that you had before. And it can create a very uncomfortable situation, and we oftentimes don't know how to deal with that. But many times we are uncertain as to whether something is a microaggression, or maybe it was just a common idiom, or maybe the person just didn't know how to ask the question. And that's okay. There's the whole thing out there that we're just too politically correct, and that it's just making life uncomfortable for everybody. Well, I want you to let that word everybody sit in your minds for a little while. Who are they talking about when they say everybody? Okay. Micro means small. Aggression. I wanted to separate that word for us today. It is an intentional or unintentional slight directed at a person or persons for whom there is conscious or unconscious bias. We all have bias. We all have it. It is when we are unconscious of it, and it causes a problem for us in our relationships, and definitely when it causes a problem for other people that we work with or we serve. The common types of microaggressions are directed at gender, gender orientation, transgender, racial, ethnicity, cultural, religious, and age. Those are just some of the common ones. Many of those bear visual distinctiveness, to where we look at someone and we know that they are different. Who are the targets? Anyone can be a target. Anyone can be a perpetrator. But typically, microaggressions are directed from someone belonging to a dominant group towards someone perceived as a subgroup or less than. Microaggressions are the path toward dehumanization, marginalization, and objectification. And especially in the current times that we are in, we have to be careful with the language that we use when we are talking to one another, around one another, and especially with the people that we serve. Of those perceived as other, there is a distinction between between recognizing individuals as different and viewing them as other. Other than what? Other than whom? That's something that we should think about. These types of words, using the word other, using phrases like subgroups, those have connotations that we have to consider. Examples of slights. They often come in the form of a backhanded compliment. You speak so well. You have nice hair, is it real? When did you decide to become gay? Are you saved? Or any religious question directed at someone you do not know intimately. Oh, you live in that neighborhood. Oh, you graduated from there. What are you mixed with? Those are all things that most of us in here can say that we have heard at one time or another. Oftentimes, we dismiss them. We don't want to confront the other person. But then we walk around with this heaviness inside of us, never able to see that person the same again. And that's painful. You would think that we would just be angry with that person, but it goes far deeper than that, because then we start wondering, who do you see when you're looking at me? What are you thinking when you're talking to me? And it shuts us down. Look around you. Everybody, seriously. Look around you. Who do you see? What connotative thoughts enter your mind? What does your body language say when you are sitting or standing near persons who are different from you? What does your facial expression, the tone of your voice, and the volume of your voice reveal? When you are speaking to people who speak a different language, do you tend to yell at them? No. When you speak to people who are older, do you speak more loudly? So those are the types of things that we should be aware of. When you have a client in the chair opposite of you, do you think about his or her culture and how it affects the problem? And can you think of ways in which culture can be used to solve the problem? We can't separate people from who they are. They bring their whole selves into that room just like we do. And there are many positive factors in their culture that can be used to help them. Sometimes they're feeling in conflict with that culture. We're supposed to help people to accept themselves. And sometimes accepting who you are, where you're from, is the first step towards healing in any regard. The best way to respond to a microaggression: don't interpret what the person said, put it squarely on them. What are you trying to say? If nothing else, you've given them some meat to chew for a while, and it will sit with them, And that's the best way to handle a microaggression. At least you know that you've informed them that you recognized it for what it is. And so now I'm going to open the floor for discussion.
Struggling with the cultural aspect. I have a client who is Japanese. She's grown up in two cultures. Her family's from Japan. I think she was born here, but then they moved back to Japan, lived there for a while. She's living here now. And part of their culture that we're running into is something she identified as ganam, which is self-blame. And there's been a lot of trauma in her family. And she's, in our sessions, blames herself for everything that's gone wrong in her family. And so part of it is what would be the natural, what we would consider in this culture, natural attempt to control, locus of control and all that. And part of it is her cultural heritage and upbringing. And just now identified it. I'm going to be struggling, I think, over the next few months to figure out how to navigate that. I don't have an easy answer.
Right. And that is a difficult one because it is something that is causing her a fair amount of pain in dealing with the issues that she has. And of course, I know who you're speaking of. And part in cultures where the maternal figure is the one who is responsible for everything, that is something that's very tough to break.
How do you challenge that view without attacking her culture?
Right. It's a very difficult thing. You just have to work on building her up in her own eyes. And that's the thing, is building her up in her own eyes, because she also lives within a family and is married to someone who is of that culture. And that patriarchal figure is a part of the equation. And I know that situation. So, so that's a very good example. And so they're just being present for her and giving her positive feedback and letting her know that she is a good person, that she is a good mother. She's going to need a lot of that. Anyone else have anything to say? Have you had an experience, something that has caused you discomfort? Not necessarily here. It's amazing the silence in the room.
I think it's because it's not too many to name. It's sort of like,
yes, that's probably very true.
Yeah, let's go through Rolodex.
So Tam, you had a hand raised?
I've been on there, being born and raised in the South. I've been on the receiving end of religious macroaggressions.
Macroaggressions, yes, yes. And that's the thing, guys. And that brings me to something that if we had hours and hours and days that we would talk about. I don't know if any of you have ever seen the TED Talk, The Danger of the Single Story. When we are faced with the one thing that we know about somebody, there is a danger of allowing that to become the umbrella that covers everything else that person is. And it's one of those umbrellas that covers the face. It covers everything. And so when we only know that one thing and we refuse to recognize that there is so much more to that person's story, it becomes very dangerous for us, and it becomes very dangerous for them, especially with what we do. In our sessions, we have 45 minutes to an hour, and we have people coming in front of us who are unfolding their lives to us. And they naturally trust us when they come in. They do. We become their person. And we have to listen keenly to what they have to say. I haven't seen it, and Carol, you can correct me if I'm wrong, but we don't have anything that we send our clients to ask them about their cultural backgrounds.
It is what they can fill out in the portal.
They can fill
Yes,
it,
there
and
are
sometimes
places
they
that-
don't. Okay. Sometimes when people come to us, we can make all kinds of assumptions. We see a black person, we assume that this person grew up and was a product of slavery in the United States, and then we find out the person is from Jamaica, or sometimes we find out the person does not even consider themselves to be of African descent at all, and we just have to stop. We have to stop with what we see and get beyond what we see. One of the things that I faced just this past week was a woman from Ethiopia, and she is having some terrible, terrible problems that is related to her culture. She says that she is a Christian, and she has that this is causing her pain because things in her family are not working the way that she wants them to do. Well, I'm not a Christian, but I understand how she feels. And so I cannot impose the fact that I am a person who does not cleave to a faith upon her, but I have to recognize that this is important to her. By the same token, if we have a person who's sitting in front of us who is not religious and we happen to be religious, we cannot impose that upon them. That's not our job. That is not our job at all. We have to be aware of the people in front of us and also be aware of ourselves and how we affect that individual. There are so many things that we can do. The way a person parents. If a person is parenting their children, they may be parenting that child according to the way their culture is. They may be parenting that child the way generations after generations after generations have parented. And they don't see that, yes, this is the reason that your children are behaving the way they are. Because guess what? Their generation is not the same as your generation. But we have to be careful because there may be cultural things involved with that. When we have a woman before us who defers to her husband and everything, those of us who are feminists, we can't look down at that woman. We have to recognize this is the world in which she was raised. And we have to empower her where she is and in the best way that we can. So this again is a discussion that we could continue to have. And so the silence is deafening when we don't say, yes, I have something to say. I know from experience, yes ma'am.
Could you go back a couple of screens for me? Please,
Sure.
if you don't mind?
Absolutely.
The one where you're talking about the dominant culture
Yes.
and the sub-culture.
Yes.
This kind of lets the subculture, quote unquote, off the hook.
It does.
As a person who was born in the Caribbean,
Yes.
of 3 or 4 different races, I find that here, because I present black, most of the biases that I receive here in the United States actually is from people that kind of look like me.
Yes.
And that's not dominant culture.
No.
Yeah. So
It
a
is
lot
not.
of blacks would look at me, I don't sound like them,
Mm-hmm.
I don't behave like them, and so most of the bias I get here.
Okay.
Because white people know I'm just not like them, period.
Yes. Yes.
But it's a kind of a seeking out, and then it's always macro sometimes.
Right. Well, within the overarching culture,
Mm-hmm.
there are layers of dominant cultures.
Yeah.
In some cultures, people who are of lighter skin, even if they are of African descent, are considered dominant. People who have certain facial features that are more Anglo are considered dominant. Christians considered dominance over other religions. Yes, we recognize that in society, and I apologize before I say this, but the white American middle-aged male is the dominant figure in our society. Then beneath that, we know is the white female. Females are microaggressed all over. So when you're a female and you're a female of color, when you're a female from a different nationality, I mean, it just goes on. So we know that there are many layers to this, and you are absolutely correct, because the majority of the people who ask me, they ask me what I'm mixed with. Don't know where that is. They're black people, because they recognize that I'm not a Caucasian, and they want to establish an affinity with me. And they received that word from white breeders, because the word race itself in Latin means breed. And so even that is highly offensive. And so I can't look at the person who is black and say, wow, you just offended me, because I know the history behind that. And so I answer them and I tell them the honest truth, because that's what they want to know. They're really saying, are you someone I can trust? You look like someone I can trust. That's really what I'm being asked. And that's very telling of the world that we live in now, is that we look at one another and we're looking for those imaginary safety pins that say, I'm a safe person. Are you a safe person? And so you are absolutely correct. There within there are people everywhere who feel that they are above someone else, and they will microaggress because of that. You are absolutely correct. Yes, ma'am.
This is, anyone can also chime in and respond to this, but the thing I struggle with culturally is balancing honoring someone's culture and having them teach me their culture, because
Yes.
there are ways that I don't necessarily think it's their responsibility to teach me, and also I know there's plenty I don't know, and I'm thinking, yes, as a person, but also kind of clinically, is like Steve, your example is kind of like, you know, finding that line of like, okay, what does sort of healthy self-cleaning look like? Like, if it's gonna be there, like, what does that look like? Because, you know, I would think most of us were sort of educated in a Western counseling sort of orientation. And so there's a way like self-clean, nope, you don't do that. Like, you gotta be self-actualizing, great, and all that, you know, so it's like, in a way, it's almost like I feel like I have to ask the person, like, okay, like, how do you do this well, you know, but at the same time, like, I don't wanna make it someone else's responsibility to teach me their culture. And so that's the thing I struggle with when it comes to applying some of these cultural things in session or with people, is negotiating that, like, back and forth of like, okay, I wanna be with you, and I recognize, like, my training is kind of in contrast to exactly what you're telling me right now. And
Right.
So, yeah.
Well, you know, one of the things is that just like when we are presented with a client who has symptoms that we're unfamiliar with, maybe we don't know quite what is going on, we research. We can also do that when we have people before us who do come from a culture with which we're unfamiliar. We can do some research so that we can better serve them. And then we have some good questions to ask them. Whenever you do ask someone the right question when they're of a different culture, they are so appreciative of that. When you nod your head in understanding and you say, you know, yes, I understand that, they appreciate that so much. It is just the little things that we do. But yes, you're right. They should not have to come in and educate us when we can't possibly know all the nuances of every single culture that there is out there. And we oftentimes do not know when someone's coming in because they don't fill out all of the paperwork. We don't even know what the presenting problem is half the time when someone comes in. So there's just a lot that we have to contend with. And so that therapeutic silence is very good sometimes for letting them open up and share something with you about that. Yes?
Even if you researched a particular culture and learned the dominant themes or whatever,
Right.
This client could be different.
Could be.
Just like not all of our white clients come from the same kind of
Sure.
culture, you know? So there are nuances, and I think there's no substitute for the client letting you know what it's like to be in their
Right.
spot, whatever spot that is.
So tell me a little bit about your childhood. When they start talking about their childhood and how the parents parented, if the father was the authority figure, then that tells you a great deal. They will talk to you about whether they went to church, or you will find out based upon some of the clues that they give you what their religion is, or if they have a religion. So you can find out just by asking the normal questions that we do, but we have to listen with an attuned ear for those cultural nuances. And yes, it is like putting the pieces of a puzzle together, absolutely.
It's interesting because like Cheryl, I have the same issue of when I first moved to America from Jamaica, I was always told, and occasionally my friends and I still joke about this, and it's become something that I've had to balance myself of. Am I black enough? Whatever that means. So in high school, I was always accused of being an Oreo, is the term that they use. So present black on the outside, but act white on the inside. Or I get that you speak so well all the time.
Yes.
It's fascinating. Yes. So code switching is something that I've always found, not I have a term for it, it's just a fun thing for me to do.
Yes.
So I was in New York this weekend, and I was there with friends, none of whom were people of color. And so I was also the only man though. So I was with two women, both were white, who grew up in America, and then me. But it's New York, so it was an interesting experience of hearing all these different languages, seeing all these different people, but always being myself, aware of who I was in the space. Because I was in Manhattan and the Lower East Side and all those places, so I wasn't in a space where I was surrounded by other people who looked like me. So it was just fascinating. We went to a Michelin restaurant, and I think I was one of 2 or 3 black people in there. So it was a fascinating thing of being very dressed up. Also, just knowing I'm in New York, so I just see the NYPD car driving around. Just for a split second, I was like, that's NYPD, and that means something specific to me. My friends would never have understood what that meant.
Right.
And I didn't say anything to them, but it was, and I was just walking down the street. But even in that situation, microaggression of watching it unfold outside of me affects me. So remembering that affects clients, whatever is happening around them still comes to them.
Right.
And I agree that we should do some research about culture, but I'm not Jamaican like my mom is, or my dad is, or other Jamaicans are. And so it's important to have some base level of understanding of it, but it's also really important to just ask the person, how do you understand how you fit into that culture?
Right.
And then the subcultures of the subcultures.
Exactly.
So yeah, it's been an interesting experience being an immigrant who's here.
Right.
And growing up somewhere else and then coming to this country.
Right. And that even has another layer to it as well, because what has happened here historically, you know, you probably hear a lot of conversation or ask questions that like
The best one I've ever been told is that you're not Jamaican because you don't sound like it. You don't look like it. All right, I'm not sure what Jamaicans are supposed to look like. I don't smoke weed and I don't have dreads. I think that's what you're talking about, but sorry for disappointing you.
And you don't wear French shorts. Yes.
Thank you, Leighton. For me, it's just so important to hear this other perspective from you, from my client. I have a woman client who talked about driving while black in, you know, way out suburbs of Atlanta. And she came in and it was, you know, something that needed to be processed. Thankfully, she's pretty open. Our experience of me as a white woman of a certain age who's Jewish, and hers as an African-American woman of a certain age who's lesbian and works for a church is something that we actually address in the session. And I'm very grateful for that, because it allows the sessions to be more helpful for her.
Yeah,
I was really fortunate in my graduate program to take a course on cultural competence. So Jiro Sue writes an
Oh my
awesome
goodness,
book.
he is my hero.
Yeah, as well, there's the stages of racial and cultural identity development, a couple of different models that, so when we meet with a client, where are they? Obviously this client is very, like I said, the life stage, whatever that is. Integrative awareness.
Yes.
But also look, you know, where are our clients who have a different experience than I do, and where am I, right? So there's so many different pieces going on. I have a couple of clients who are like the third wave. You know, they may have parents from two different cultures, and then they're the third one, and they identify more with other people like them than any one culture. I have some who are Americans born of immigrants, and if their parents' culture is collectivist culture, and here they are in a highly individual culture, that needs to be navigated.
Right. That was, I was just reading some research yesterday about the microaggressions that are, they could be racial, even within families, when there are families who have so many different, I mean, trust me, I've got brother with a fro, I've got brother with blonde hair and blue eyes, and I've got the brother with the long Indian hair like me. We don't even look like we're from the same family. And so mother was always thought to be a foster mother because we all looked so different. So there are so many throwbacks in my family. It's just amazing. But there are definitely within families people who microaggress against one another because one is perceived to have the more acceptable features or whatever. So those are some things that also we may see coming in through our doors. But that's an amazing experience that you had.
Yeah, I mean, when I go out into the world, I expect a certain response. Some of it is ignorant based on what people don't know about me, and some of it is, you know, on the face of it, I present a certain way, and I kind of become something I'm used to.
Yeah, yeah. JD?
What are some helpful ideas for dealing with when a client microaggresses against you during a session? Because I had a client who, this during my internship, like she and I saw each other every day, like she knew that I was gay. When she was talking about her parents' divorce, she said, well, I'm not that upset that my dad got married again. I mean, it's not like he went gay or anything.
Wow.
And like immediately I was pulled out of the session. I was just like, what? Wait a minute, what did I just hear? Like, how do you deal with stuff like that?
That's just something where you just have to take a beat, but then say, why would that have been a problem? Why would that have bothered you?
I'm going to challenge that or play with challenge.
Sure.
Challenge it. As a therapist, then, if he responded that way, he would be doing his own therapy with his client.
Right, but just to explore her feelings with that because she just microaggressed him. Right.
But that may not be germane to why she.
Right. Well, sure, but you know, and you could separate yourself from the situation, but she obviously has something that's beneath the surface, and she blurted it out. So not necessarily asking it in a confrontational manner, but even with silence, just sit there for a minute, give her a second, which I guess it's already happened, but give her a second to realize what she did. Somehow or other it will be revealed. I mean, asking why questions can put somebody on the defensive for sure. So just in a different way, obviously, but, you know, yes ma'am.
I'm going to take a different approach because, again, you want her to feel comfortable to be who she is and say what she says,
right.
Even though it has an impact on you, and see it more as an interpersonal issue in the session, particularly since she knew you were gay, that I would assume that that's something that she's angry about or some discomfort maybe she has
talking with a gay therapist. So I might wanna talk about, well, what just happened and look at that interpersonally rather than you're wrong to do that.
Right. Yes. Yeah.
I think it's relevant. I mean, if she said it clearly to her father being gay is almost the worst case scenario. So I don't think that it's even a confrontation to ask a follow-up question to that. What would it mean if he were to be gay? Like, why is that something that she views as like the worst possible outcome for her parents getting a divorce? If she threw it out there, it's relevant.
Right.
That sounds different to me than the why question.
Right.
Yeah. So framing it that way can really process those interpersonal dynamics that Pam is talking about. And I think that's appropriate as long as you're processing some internal processing with her around the relationship with the father.
Right.
That keeps the focus on her and the relationship with the father versus about me as a therapist.
Right. Because
so how the question is directed and what it processes.
And I might want to say, how is it to work with me knowing that I'm a gay therapist?
Right.
Because that's different from why don't you like gay people?
Right. Is that preventing you? Right.
Together, given that you
Right. Right. Yes.
Yeah, I ran into years ago. I was in a store and looked at plants, and this very attractive couple, male, female couple there, and you know, and she asked me, "Are you going to buy the plant?" I said, "No, it's kind of expensive." She said, "Well, go over to such and such store. You can always Jew them down."
Wow.
And I was just silent for a minute. She said, "Did I say something wrong?" I said, "Well, I'm Jewish." She said, "Well, that doesn't mean anything. It's just part of the language. It's part of the vernacular." And you know, at the moment I didn't have the presence to say that, but it does mean something because it establishes a mindset. It either reflects a mindset or establishes a mindset. Language is important.
Right.
Language does matter.
It does.
You know, but you have to choose where you're going to confront and what is the reason for, say, confronting, challenging.
Is this someone you could walk away from, basically, in that situation?
Safely, but also, you know, in a situation where I have clients, you know, I think it's important to bring into the room, are you, you know, I am gay, or I am white, or I am whatever, I'm Jewish, Christian, are you okay working with me, or is that going to create a problem? Because if it is, we need to process that. That's part of building our therapeutic relationship.
You lead with that in a session.
There have been on a couple of occasions, usually with African American clients, we'll be talking in early or mid-session, you know, they'll say something. I don't automatically do it, but if the client says something, then I'll respond. So I've had clients say, well, you know, are you gay? Because you may not understand what I'm talking about, or I'm going to be using slang, and because you're white, you may not get it. And at that point, I'll just say, well, do you think it's going to be an issue for us that you're black and I'm white, and you know, or can we work through this? And usually I get a positive response and a very supportive, but it deepens relationship, or makes the possibility of the relationship deepen. I don't inject it artificially, but if it comes into the conversation, I absolutely address it. Problem? Oh, I'm drowning here.